Hello and welcome. Today, we're diving deep into a condition that can significantly impact vision: corneal scarring. We'll explore what it is, what causes it, how it's diagnosed and treated, and what you can do to protect your sight. Corneal scarring can arise from a variety of insults to the cornea, that clear, dome-shaped front surface of your eye. The most common culprits include infections, such as bacterial or viral keratitis, particularly those caused by herpes simplex. Trauma, like scratches, abrasions, or even penetration from foreign objects, can also lead to scarring. Other causes include corneal ulcers, inflammatory conditions, like certain autoimmune diseases, and even complications from eye surgery, like LUS-IK or cataract surgery. In some cases, wearing contact lenses for extended periods or not cleaning them properly can increase the risk of corneal infections and subsequent scarring. When the cornea is injured, the body initiates a healing process. However, unlike skin, the cornea doesn't always heal perfectly. If the damage is deep enough, the normal, transparent corneal tissue is replaced by opaque scar tissue. This scar tissue disrupts the smooth surface of the cornea and interferes with the passage of light to the retina. The extent of vision impairment depends on the size, location, and density of the scar. Deeper and more central scars naturally have a greater impact on vision than smaller, more peripheral ones. While precise global statistics are difficult to obtain, corneal scarring is a significant cause of visual impairment and blindness worldwide. Its prevalence varies geographically, with higher rates often found in regions with limited access to healthcare, poor sanitation, and higher rates of infectious diseases. In developed countries, trauma and contact lens-related infections are increasingly common causes. It's important to remember that anyone can be affected by corneal scarring, regardless of age or ethnicity. The signs and symptoms of corneal scarring can vary depending on the size and location of the scar. Some people may experience blurred or distorted vision, a feeling like something is in their eye, increased sensitivity to light, known as photophobia, and excessive tearing. In more severe cases, there may be a visible white or opaque area on the cornea. If the scarring is minimal and located at the periphery, it may not cause any noticeable symptoms at all. Diagnosing corneal scarring typically involves a comprehensive eye examination by an ophthalmologist. This will include a visual acuity test to assess your vision, a slit lamp examination to closely examine the cornea for any signs of scarring or abnormalities, and potentially corneal topography, which maps the surface of the cornea to detect irregularities. In some cases, special stains may be used to highlight the scar tissue and assess its extent. Your doctor will also ask about your medical history, including any prior eye infections, injuries, or surgery. Corneal scars can be classified based on their size, location, and depth. Superficial scars are typically less impactful on vision than deep scars. Scars located in the center of the cornea, directly affecting the line of sight, will cause more significant vision impairment. The density, or opacity, of the scar also plays a role, with denser scars causing more light scattering and therefore greater vision loss. Based on these factors, your doctor can determine the most appropriate treatment approach. Treatment for corneal scarring depends on the severity of the scarring and the impact on vision. For mild scars that are not significantly affecting vision, no treatment may be necessary. However, in more severe cases, options include prescription eye drops or ointments to reduce inflammation and promote healing. In some instances, corneal transplantation may be required. This involves replacing the damaged cornea with a healthy donor cornea. Procedures like partial thickness corneal transplants or even artificial corneal transplants may be considered depending on the individual case. Contact lenses, particularly specialized lenses like scleral lenses, can also be used to improve vision in some patients by masking the corneal irregularities. Preventing corneal scarring is often about taking proactive steps to protect your eyes. This includes practicing good hygiene when handling contact lenses, wearing protective eyewear when participating in activities that could cause eye injuries, and seeking prompt medical attention for any eye infections or injuries. Regular eye exams are also crucial for early detection and treatment of potential problems. The prognosis for corneal scarring varies depending on the cause, size, and location of the scar, as well as the success of treatment. In some cases, vision can be significantly improved with treatment. In other cases, the scarring may be permanent and lead to some degree of visual impairment. Research is ongoing to develop new and improved treatments for corneal scarring, including advanced surgical techniques and novel therapies to promote corneal regeneration and reduce scarring. For example, stem cell therapies are being investigated for their potential to regenerate corneal tissue and restore transparency. Thank you for joining us today. Remember, early detection and prompt treatment are key to managing corneal scarring and preserving your vision.